Good morning. I am Dr. Claudia Thomas, and I thank you for accepting my invitation to join me in my second Facebook Live presentation. Today's topic is cancer is not a death sentence. Yes, I'm talking about the big C, things that people don't want to talk about, and generally, when you hear those words from a physician, you have cancer, well, it sounds devastating and you don't hear anything else. But I'm going to tell you that when the doctor told me, Claudia, you had cancer, we found it and we took it out, my response was, praise God. And I claimed the cure. Now, let's first have some common sense and acknowledge the fact that nobody leaves this life unscathed. So every one of us is going to die at some point from something. But it probably won't be cancer. The American Cancer Society predicts that 2 million Americans will be diagnosed with cancer in this year, 2025, and that more than 600,000 of those people will die from cancer. So cancer is the number one killer, right? Wrong. That's the buzzer, my buzzer. You should all know that the number one killer of human beings in the world is ischemic heart disease, heart attack. It affects 13% of the world, and of course, 13% of the deaths in the world. In 2021, guess what number two was? COVID. And no, COVID is not gone. Not as many people are dying from it, but it is still on the planet, and you still need to protect yourself and use some common sense to prevent yourself from getting COVID-19 and other respiratory infections. Number three, stroke. You probably know someone who has had a stroke, especially if you are African American, where the incidence of stroke is higher than it is in other races. But stroke is the number three killer. Number four, COPD. What is that? It's pulmonary disease primarily from smoking. Hey, you want to give yourself a disease? Keep smoking. COPD is the fourth most common cause of death. And lower respiratory infection is number five. So an infectious condition, be it COVID or RSV or pneumonia or bronchitis, is the number four killer. We haven't hit cancer yet. Cancer is the sixth most common cause of death. And lung cancer has increased in its incidence, although the overall incidence of cancer has actually decreased over the past few years. So cancer is down there on number six in terms of things that caused you to die. And there are more than 200 types of cancer. There are all kinds of different cancers. You can get cancer in your finger. But it is not necessarily a death sentence when you're told that you have cancer. 1 out of 2 people will develop some form of cancer in their lifetime. What's the most common? Breast cancer. Number 2, lung cancer. Number 3, prostate cancer. And number 4 is bowel cancer, like colon cancer. And how do they present themselves? Well, any lump on your body that appears that wasn't there before needs to be checked out. Cancer also often appears as a lump. somewhere in your body. It may be on your back, so your whole body needs to be checked periodically, or I should say frequently, for any new lumps or swellings that have suddenly appeared. What is another sign? Unexplained bleeding. Bleeding that you didn't have before. Bleeding from anywhere, from your mouth, from your nipple, from your vagina, from your anus. Always look at your toilet paper before you flush it. So unexplained bleeding could be a sign of cancer, especially in the colon, but anywhere that's bleeding, that needs to be evaluated. And changes in your bowel habits. Now, let's talk about adults. If you're an adult, you've been on this planet at least 21 years, you've grown. And you know what your bowel movements are like. You know what your poop looks like. You know what your poop feels like. You know what your stomach feels like. As that changes, all of a sudden you're having diarrhea or severe constipation. Don't just say, well, I wonder what that is. Let your doctor know. Go to a doctor. That's why we have doctors. Any changes in your bowel habits need to be evaluated. And tests will be done to make sure that it's not cancer. But it could be. And it needs to be checked out. Don't be afraid to find out what's going on in your body when your body habits change, when things change. Ways to reduce your risk of cancer are, number one, throw away the cigarettes, please. Don't tell me you can't stop smoking. Smoking increases the risk of all types of cancer, not just lung cancer, but all types of cancer. And it's a habit, it's habitual, and you can stop it. You need to maintain a healthy weight. You know you're overweight, so do something about it. If you have to get something and stick yourself with a needle every so often, one of these diabetic drugs, that's better than carrying an unhealthy weight. Being obese is a risk factor for cancer. Eating a healthy diet is important. And if McDonald's is your number one drive-in, you got to change that, sweetheart. You know when you're eating a healthy diet, you know when you're not. And if something in your life makes you a fast food junkie, then you need to change those habits, change your life so that you can take care of you by bringing home fresh fruit, vegetables, and making them a regular part of your diet. You know what healthy food is. You know what healthy food is not. And please, when you feeding your children the mess that they serve at the drive-thru, it's criminal. You're just setting them up for disease when they get older. Regular exercise. Walking doesn't cost you anything. Regular exercise to stimulate your muscles, your heart, and keep your body functioning as God intended it to. No or low alcohol. Drinking alcohol in excess is also a risk factor for developing cancer. And protection from the sun. If you're a person of color, somebody might have made you think, I don't need sunscreen. Sun ain't gonna bother me. What did Bob Marley die of? Cancer, skin cancer, melanoma. So protect yourself from the sun's rays. They've gotten stronger over the years and can turn a regular looking arm to a cancerous arm. The message is that if you find that something abnormal is going on in your body and you're concerned about it, you need to go to the doctor. Don't have a doctor, go to urgent care. But you should have a primary care physician whom you see at least every 6 months to check you out, because things happen when you don't get them checked out. So you have cancer. What are the treatments? No matter what kind of cancer it is, most commonly it will be treated surgically. It will be removed with an operation to get it out of your body. Second will be chemotherapy. Now, what is chemotherapy? Chemo is a medication that is used to help slow down the cancer. And how does that work? Well, cancer happens when cells that are normal cells, you know, little teeny structures that make up your whole body, change for some reason. And I just gave you reasons that they may be inspired to change, things that could cause cancer, but for the most part, we don't know why that breast cell turned from normal to malignant. But these cells that change start to multiply and become abnormal and take over the space of the normal cells. This is a very simplistic way of telling you what cancer is. And they interfere with the function of the normal tissue when they occupy the space. So that's why we couldn't cut it out. Sometimes certain cells, and every cancer is different. Like I said, there's over 200 different types of cancer. Every cancer is different. It responds to different things. The cancer cells will sometimes respond to chemicals, chemo. This is a medication that will target that cell and kill it or decrease the speed and aggression with which it replicates itself. And it can help kill cancer. What are other ways that cancer is treated? With radiation. Strong X-rays, which can be pinpointed like a laser to where the cancer is and kill your cells as well. No knife, no other invasive things. Radiation can kill some cells respond to it. And you won't find this in your textbooks necessarily. But another way to treat cancer, I'm not saying it's the only way, but an adjunct to all these treatments is prayer. Prayer circles. Prayer cures people. And the amazing thing is that studies have shown that you don't have to know someone is praying for you for that prayer to help you eradicate disease. Prayer circles. The more people praying for you, the more effective. In 1989, I lived on St. Thomas. And in September of 1989, to be specific, September 18th, a Category 5 hurricane struck the Virgin Islands when I was living on it. Virgin Islands hadn't had a hurricane in 50 years. So the old folks said, oh, it will turn to the north, and they all go to the north. Don't worry about it. Well, by the time we realized that this one wasn't turning, and it was heading straight for us, it was sort of late to be boarding your house up and protecting yourself. And that Hurricane Hugo hit the Virgin Islands, St. Thomas, St. Croix, St. John, as a Category 5 hurricane with wind gusts up to 250 miles an hour. In fact, the reconnaissance plane that goes down in the hurricane, you know, to measure the gusts and all that, was almost lost because these winds were so fierce. And even today, strong hurricanes are compared to Hugo. Well, now, by the time you know the thing's coming, nothing's flying. Nobody gonna fly in a hurricane to take you back up to the north or the mainland or out of danger. Nothing. You would risk the plane. Nothing is sailing. Nothing is out there in that ocean with the monster coming to get you. So you hold up in your house, praying that it was built well enough to protect you. And on September 18th, 1989, I was holed up in my home with my husband who had built the house. Now, he had an excellent reputation as a builder, but he was going to be tested. Power's out, you're in the dark, you got a little tiny lamp light, and all I could hear outside was ferocious winds, which would crescendo, and I would look up and wait for the roof to go. I couldn't understand how the roof was not going to fly off in those winds. And then you would hear the roofs of many of the homes in the Virgin Islands are made of galvanized steel because it catches rainwater that goes into your water supply, which is under your house, your cistern. Well, these roofs were being ripped off and were flying through the air like giant razor blades. And you hear debris going through the wind as houses are being ripped apart. We did have radio. The local radio station stayed on for a while. And what you heard was people calling in, "Come and get me. My house is down by the flamboyant tree." We didn't use road signs much, but people were calling in for the National Guard to come and get them. We couldn't rescue anybody in the middle of the storm. One caller added a bit of humor and said, "I'm being bombarded by my own coconuts." And coconuts were flying off his tree and hitting the house. But it wasn't funny. It was the most terrifying experience I ever had. Now, you may be aware that stress causes disease. That's why the descendants of American slaves who still have that slavery experience, that ancestral experience in their genetic history, more likely have hypertension and diabetes and strokes. The stress of living, the stress of our ancestry can precipitate disease. Hugo was the most stressful thing I had ever experienced. And before Hugo, I was a very healthy young person. But after Hugo, I began losing weight. My skin began to darken, particularly around my eyes. I looked like a raccoon. And there were a lot of changes in my body. So at that time, I tried, fortunately, some of my relatives were on vegetarian diets. They were with the Seventh-day Adventist Church and showed me how to have meatless food prepared and how to eat a healthier diet and eat things that were growing out of the ground that were healthy in the Virgin Islands. But I kept getting sicker and I kept losing weight. So I contacted a physician in the mainland in Baltimore, where I had been on the faculty of Johns Hopkins. And I contacted this physician and he recommended laboratory testing. And those labs came back showing that I was in kidney failure. Kidney failure from the stress of having gone through this hurricane, which at any second promised to take my life. The doctor told me, well, you need to come north, you need to come to the mainland, and we can either give you a transplant or put you on dialysis. So I went north. And if any of you, and I'm sure some of you have known people on dialysis, it will keep you alive, but it's not a very good quality of life, not a very nice quality of life. And transplants occur, but they're so rare that they still make the news. Oh, somebody gave a stranger a transplant. Isn't that wonderful? You know, that's still a current news story because people don't do that. But I have a sister who loves me, and she volunteered her kidney. So I came to Maryland, and in June of 1990, my sister and I went into surgery so I could receive her life-saving transplant. The night before surgery, my doctor, whose name was Dr. Light, of significance to all of us, his name was Dr. Light, and he said, there's a mass in one of your kidneys that is larger than it was on the last ultrasound, because they had repeated all the tests. And he said, there's a 99% chance it's nothing but a cyst, but I don't want to take that chance. I would like to biopsy that kidney before I take your sister Catherine's kidney out of her body and put it in yours. And my mother, who always had the last word, spoke for us and said, doctor, do what you have to do. But remember, you're only God's instrument. So we went to surgery. They kept Kathy in a holding area, did not take her kidney until they had biopsied mine. I woke up with Dr. Light telling me, Claudia, you had cancer in both your kidneys. We had to remove them to save your life, and you'll have to go on dialysis. We don't recommend that you get your sister's transplanted kidney because we don't know if that cancer has spread. I was just waking up from surgery, and things were fuzzy, but I understood what this doctor was telling me. That by holding off on the transplant and investigating what he had seen on the ultrasound, he had saved my life. I didn't have kidneys, but I was alive. I would have to go on dialysis until they could make sure by doing studies over a year that the cancer in my kidney had not spread to the rest of my body. And I still don't know where this came from, but rather than saying, oh Lord, I had cancer, oh Lord, I said, praise God. And I'm still under anesthesia. I said, praise God. I had cancer. He found it. He has taken it out. And he may have to wait a year to make sure it hasn't spread, but I know that that was done as a cure. God would not have moved him to remove both my kidneys had it not been for the cure. That was in 1990. I'm still here. I'm still here. We waited a year. The cancer had not come back. And there were other things and circumstances that happened, which you can read about in my autobiography, God Spared Life, available on my website. But I am still here. I was cured. So this is to tell you, you don't feel right. You're losing weight. Bowel habits changed. Urination has changed. There's bleeding somewhere that it shouldn't be. You got a lump in your breast or other part of your body. Don't sit and wait. Doctors are here for us. You don't like your doctor, you don't think your doctor's saying, get another one. But get it checked out so that if it is cancer, it can be found in the early stages and you are so much more likely to be cured. The diagnosis of cancer does not have to be a death sentence. And in most cases, it is not. But if you cower in the corner, afraid of the diagnosis, then your outcome may not be so good. Cancer is not the number one cause of death. As I told you, ischemic heart disease, that's a heart attacks, is the number one cause of death. COVID is not number two anymore. It was in 2021, but it is still there and it still will kill you if not treated properly. Stroke, lung disease, COPD, usually from having smoked like a fool, and lower respiratory infection. That's anything from pneumonia to tuberculosis, which is making a resurgence. RSV, they happen more commonly and kill more people than lung cancer, than cancers, and all cancers. So if something is strange and it's going on in your body, and you have been in that body for decades, and you know it's not right, it's not you, please don't hide. Please don't fear. Do pray and tell your friends to pray, but go see a doctor and find out what's going on so that we don't lose you to cancer. I hope this benefits somebody. And we will take questions at this point that have come in.
Dr. Thomas, there are no questions at this time, but there are lots of great comments.
Okay.
And I can oh, okay. There's one question actually. How does AI affect cancer research?
I have no idea how AI affects cancer research. And I'm sure that it affects it somehow, hopefully in a positive way. But I would not be able to tell you anything that's reliable about what is happening with research and AI.
Okay, and joining us today is your sister, Miss Kathy. Sharon Parker says, this is what Black history is all about. And James Davis says, thank you for your courage, Dr. Claudia and Catherine. And that's all we have today for questions.
Very welcome. You're very welcome. And again, my autobiography is called God Spare Life. And it's available on my website, which is www.claudiathomasmd. At this time, I have a brief video that tells you a little bit more about me. You can watch that, and Nakia, my assistant, who you just heard, will play it.
Claudia Thomas changed the face of orthopedics. Dr. Thomas became the first female African-American board-certified orthopedic surgeon in the United States. She was a leader in mentoring and bringing more African-American medical students into orthopedics. This trailblazer's journey began in New York. Born in Brooklyn and raised in Queens by her parents, Charles and Daisy Thomas. Although denied higher education themselves, her parents stressed the importance of education to their daughters, Catherine and Claudia.
She was always a good student. Our parents emphasized education, so of course we knew what was expected. And our parents had the foresight to recognize that we were talented as children, and they fed those talents. I'm sure they were thinking, as African Americans, this was one of the ways that we could advance ourselves, and that was through education.
Dr. Thomas excelled as a student, creating her opportunities. She attended the High School of Music and Art in New York City. Her high test scores earned her a National Merit Scholarship and the New York Regent Scholarship to attend Vassar College. It was at Vassar that Dr. Thomas became an activist. After the assassination of Dr. Martin Luther King Jr., she helped form the Students Afro-American Society, SAS, on campus. Because of Vassar's limited number of Black students and Black curriculum, Dr. Thomas and others in SAS demanded that the college expand Black studies into a degree-granting department and increase the number of Black professors. When the administration refused, Dr. Thomas and several other members of SAS staged a protest and took over the college's main building. That takeover lasted 3 days until the college finally agreed to the creation of a Black Studies major and a commitment to hire more Black professors. It became the model for Black Studies programs around the nation.
This was important because we were in the midst of the Civil Rights era. Everyone's consciousness was being raised by the leadership of Dr. Martin Luther King Jr. We saw it as our responsibility to join in those efforts to enhance the rights of our people.
Dr. Thomas graduated with honors from Vassar College as a Black Studies major and moved on to new challenges at Johns Hopkins University School of Medicine. Although Dr. Thomas faced unconscious bias and racism, she persevered, excelled, and graduated with honors. Her graduation from the Johns Hopkins School of Medicine in May of 1975 was a family celebration. Dr. Thomas's academic excellence at Hopkins attracted the attention of Dr. Wayne Southwick, who was chairman of Yale University's Orthopedic Resident Training Program. He recognized Dr. Thomas's talent and accepted her into their residency program. Although not the first person of color to train in orthopedics at Yale, she would be the first African-American woman to be admitted into the Yale residency program in orthopedic surgery. After finishing her residency at Yale, Dr. Thomas completed a fellowship at the Shock Trauma Center at the University of Maryland, one of the top trauma centers in the U.S. In 1981, she returned to serve as assistant professor of orthopedic surgery at Johns Hopkins University School of Medicine. On the faculty at Hopkins from 1981 until 1994, Dr. Thomas recruited the largest number of minorities and women to train in orthopedics at Hopkins. In 2004, Dr. Thomas left Hopkins and joined a private practice, the Tri-County Orthopedic Center in Leesburg, Florida. In Florida, she continued to mentor young girls and boys. In 2008, Dr. Thomas was awarded the American Academy of Orthopedic Surgeons Diversity Award for her efforts in improving diversity within her field and for mentoring so many young men and women.
Dr. Claudia Thomas is a trailblazer in the field of medicine. She is the first female physician of African descent to complete residency training in orthopedic surgery and to be certified by the American Board of Orthopedic Surgery. Her life has been an example of career preparation, the highest level of professional performance, and a deep sense of responsibility to pave the way for others to succeed.
That's a mouthful of compliments, a mouthful of words. But what it meant is that this lady was a pioneer. She was a groundbreaker. She had the qualities and broke down barriers that were very, very difficult to do. I consider her to be someone who I stood on the shoulders of. She was a giant. And people, behind her may or may not recognize how much she's done to allow them to succeed in orthopedic surgery.
She, I'm sure, inspired others and gained the respect of people who didn't know that African American women could be good orthopedic surgeons and contribute as professional orthopedic surgeons as well as anyone else. And people who had conscious or unconscious doubts about that had an opportunity to be educated by seeing a three-dimensional, real-world, living, working orthopedic surgeon who did what she was doing.
Simply put, Dr. Claudia L. Thomas is unique because she's A, a pioneer, B, a unicorn, and the antithesis of what an orthopedic surgeon was slated to be. She turned that paradigm on its head, and over the past 5 decades has proven that she actually is what an orthopedic surgeon can be, should be, and is capable of being. That opened the door for all of us.
She worked particularly hard while she was at Hopkins to increase the not only women but Black women, and it's very important because it was difficult as a female to get into orthopedic residencies. Many programs were very hesitant to have anything besides white males in their program, and the diversity, as with all things, really helps everyone.
Dr. Thomas is amazing. She's selfless. She's endured so much, but always has thrived and succeeded, and always brings along with her others, whether it's in orthopedics or in her community or nationally.
She is so special because she has always had some health challenges during her life that she has overcome and that she uses as a reason to care for others. Her empathy shines through at all times.
I would say that she's one of the kindest people I know. She also was extremely skilled technically.
I think that Dr. Thomas has such a unique presence. It's hard to explain, but when she's around, you know she's around. You can feel the room fill with kindness. She provides a smile. She provides support. She's just an incredible, talented orthopedic surgeon and an outstanding, awesome person.
I consider it a privilege and a pleasure to have had her as a friend, and it's been tremendously gratifying to see the contributions that she's made. And I think she's a wonderful role model.
She modeled for me what giving and supporting the next generation of surgeons looks like, by investing in me, by showing up for me, by answering my questions, my calls, editing my personal statement. She showed a commitment and offered herself as a support mechanism. And she was the only person that supported me in that way at that time. So because of that, I replicated her actions through interventions and the other work that I've done over the years. I attribute that to her.
So she's been influencing people for over 30 years. So what's 30 times a million? I mean, once you teach one person to fix, then doesn't that help the whole village? So I would say that Dr. Thomas has led and influenced the entire orthopedic community, and her reach, impact is unmeasurable, actually.
In honor of Dr. Thomas's lifetime pursuit of excellence in education, for her leadership in recruiting more minorities and women into orthopedics, and for her tireless efforts in changing the face of orthopedic surgery in the United States, we have established the Claudia L. Thomas MD Award. Thank you, Dr. Thomas, for being a role model.
Good afternoon. Thank you for establishing the Dr. Claudia L. Thomas Award in my honor. Our first recipient embodies the grit, determination, and academic excellence that are the pillars of my career and of this award. Among numerous other honors, she is department chair and the Dr. John Murray Professor of Orthopedic Oncology at the University of Texas MD Anderson Cancer Center. The award is a limited edition print depicting the legacy of African-American female physicians. I own the original, created by world-renowned fine artist Leroy Campbell. Please join me in congratulating Dr. Valerie Lewis as the 2024 Dr. Claudia Thomas Award recipient. Well, thank you for tuning in. Thank you for your attention. And I hope I've helped someone today. That ends our program, unless there are additional questions that have popped up while the film was playing.
No additional questions, just good comments.
Okay. Well, thank you all. And I expect to see you in 2 weeks with another presentation on Facebook Live that is based on my life experience and my profession as a physician. And I will be trying to help somebody. Goodbye.